most of the funding in international health goes into the three big diseases, which is malaria, AIDS, and tuberculosis. And it's appropriate that those things be well funded. But when you consider that the death and disability annually from trauma alone is greater than the death and disability from those three big diseases combined, then you realize, ooh, perhaps we better sit back and ask ourselves, how are we responding to trauma? What are we doing to prevent trauma? When trauma occurs, what are we doing to treat it in an appropriate and timely fashion? And for those people who have trauma to the point that they're disabled, what are we doing to try to bring them back and reincorporate them into the community so that they can live normal lives?
The Department of Surgery is very honored and excited to be participating at a time like this in the stewardship of international health.
I think there's a built-in desire to just about anybody who goes through medical school and becomes a resident. There's this want to make a difference. They can all get passionate and excited about doing something in global health. It's about time that we have this outlet for surgical types.
First of all, the interest is there. There's a huge increase in recognition among medical school graduates or just people coming out into the workforce that they want to make a bigger, broader impact.
And it was not until coming here in my interviews and meeting with individuals like Dr. Hamid who are substantially involved in international care where I became quite interested in this program. And I would have to say it's because of that that I've decided to come here for surgical training.
I mean, the whole goal for me is to, at some point, put all of these ideas into practice and actually make an impact. But what I'd like to see is more courses that kind of take it a step further.
The current interest that we're seeing in international health generally and in international surgery specifically is real and genuine. I don't think it's just a passing fancy, a passing phase. I really do think that trainees now are very conscious of the fact that there is a huge discrepancy in resources around the world. Their interest to somehow address this is real. There's just huge discrepancies between the haves and have-nots in terms of health care. And that certainly includes surgical care, essential surgical care. We're not talking about complicated, highly costly procedures. We're really talking about basic surgical care of maladies that exist in every community in the world.
We're connected in every aspect, and if you believe in a phenomenon like the butterfly effect, whatever happens over there will eventually affect us. And so I feel as though it's our responsibility to respond to that and to help in whatever way possible. And that's really why I do this, is because it's just being human, and that's what it's all about.
There was a young peasant family in rural Bangladesh who had a child who had cut their foot and it became badly infected, and they simply didn't know how to take care of it in terms of basic hygiene. And they brought their child in, a little infant boy, and he was quite sick, but it was simply just because of a cut on the foot. And as soon as I walked in with the surgeon, they fell to their knees on the ground. They just were so thankful and grateful.
If we are in a position that we can somehow help to address those disparities, we really ought to do so as human beings. I think it's required of us.